I took a very long time to come to terms with the fact that I need help for my mental health. And then I was so scared of telling my parents about it, so I felt the need to hide it from my friends, from my family. And there was so much confusion and this fear of what everybody would think about me. But eventually what I realized is that the only way to overcome this confusion and fear is to learn about it and to educate ourselves. So I have a lineup of mental health professionals who will help us understand a different perspective and hopefully help us discover a healthier and happier way of living. So to begin with, I have my friend Drishti, who happens to be pursuing her MA in Applied Psychology at TISS. And while I was talking to her, I realized it's helpful to understand the concepts at the very core. And I wish I knew some of these things before I started my journey of getting help, to know the difference between what the right kind of help is and what will work for me versus what wouldn't work for me. So I hope you enjoy this conversation with Drishti and let's learn together about mental health. I think we as individuals so many times don't notice physical things that are obviously visible in front of us, that it's so easy to tune out of things that are invisible or that happen in our head.
Yeah.
And I think that's what happens when you experience any anxiety, any mental health issue. It's so easy for you to not notice. I think the same thing happened to me. It was so confusing as an emotional experience and I wasn't understanding anything. And because I wasn't understanding it, I obviously didn't take any action towards it. I didn't know what to do. No comprehension of what was happening to me. And because I kept ignoring it, I ultimately had a physical breakdown, which is sort of when I realized something was wrong. And that is when I wish I hadn't waited so long, because I ignored small signs which made so much sense in hindsight.
Yeah.
But I didn't pay any attention. But because I didn't know any better.
Yeah. I think it makes sense when you backtrack.
Yeah.
And then you're like, oh, I get it now, but you've reached here, the volcano's kind of erupted, and then there's lava everywhere. What do you do with it?
And I think that's why it's important to educate ourselves about these things from the beginning. For everybody, right? So that you identify early signs, take care of yourself, protect yourself, self-care, everything. And I think it's good that we're having this discussion today, where I think I can share my personal experience and you can break it down for the audience.
I can try.
You can try.
Yes.
Of course, that's what we're doing
Yeah.
here. I mean, and we're trying to help other people relate to our story. It's never going to be the same for them.
Yeah.
But hopefully it will help them to understand softer aspects which are not so obvious.
Yeah.
Yeah.
I think, from what you say, I think something that resonates is the fact that what drives individuals in general all the time is our need to want to make sense of our reality and everything that surrounds us. So I think it's equally important to turn inward and make sense of what's going on inside the machinery that's doing the work outside. So do you want to tell me about what led to the final physical symptom that you spoke about that allowed you to backtrack and make sense of what was happening?
The physical symptom, at that time I remember my appetite had gone down significantly. So I kept thinking it was a gastro issue. So I was taking all possible gastro medicines at that time, imaginable, thinking that it was a gut issue. And I remember it was a Sunday, so I was sitting with a friend. As routine or setting as possible. I was having breakfast, my body was aching and my arm was hurting. And I said, oh well, it's my right arm, so it possibly can't be a heart attack, right? But I was like, okay, well, this is not normal. Why don't we go to the hospital? And by the time I reached the hospital, both my arms were shooting. It had gotten to a point where I couldn't ignore it anymore. And at the hospital, they checked my vitals, everything was fine. And even the doctor took some time to first figure out, is there something physically wrong with me? And then I calmed down, I was taken to a senior doctor. And all he said in the end was, Bachche, that you're very stressed. And then when I walked out later, I was made to understand in a very normal, relaxed setting that I had a panic attack. And then they gave me steps on how to identify it early on, what all can I do. And since then, it's been a lot easier. And I've had a similar incident in the past, and I didn't even realize it because at that time I was in the US, I had nobody around me. So it happened, it passed, and then I made nothing of it. So it's not like it's not been happening over the years. It has been. Just you don't pay attention.
Yeah, so I was thinking, you said that it's been a lot easier after the doctor told you have stress and someone explained in terms of whatever diagram they drew for you that this is what a panic attack looks like.
Yeah.
But I think it's equally important to realize that when it comes to mental health, identification, you need to realize when something's wrong, but that's not enough.
Yeah.
So I think it's really important to realize that just going to a doctor, getting a diagnosis, so to say, is not enough.
Yes.
It's something you do all the time. Like, I brush my teeth every day, but I also floss.
Yeah.
And flossing is a little like extra work out there, but it helps.
Yeah.
And we do it. So just like clean your brain,
After that incident, I realized how important counseling is.
Yeah.
And I have been to counselors before any of this happened, and it didn't feel right. I didn't feel like I was deriving the benefit of it. I didn't feel like the first time I remember I went to a counselor, I didn't even tell my parents because I was so ashamed that I needed to go to a counselor, I was so ashamed of it. And when I went there, imagine this is the first time I'm telling somebody how I'm feeling, and they're like,
oh, I'm sorry.
Yeah, but it happens all the time. And in hindsight, I was like, oh my god, I need to rush through this.
Yeah.
But I didn't think there was something wrong with the setting.
I was just going to come to that. You said you've been to a couple of counselors, so to say. So how do you understand counseling? What is counseling to you? What is a counselor for you?
Listen, I didn't understand anything. Okay, so back then I was Googling psychologists around me, psychiatrists around me, help for anxiety, help, normal
and do you think that there's a difference between these professions, or do you think they're just different names for the similar kind of practice?
I mean, now I know that.
Now you know,
The difference that I knew as a educated layman still is that psychiatrists can prescribe you medicines, psychologists can't.
Yeah.
That's all I knew. So I was like, okay, I'm going to go to a psychiatrist because I want to get better fast. And I want those, I want that external help to feel better.
Yeah.
So when I went to a psychiatrist, he prescribed me medicine. He heard me for 15 minutes. All of my life issues, right? He heard me 15 minutes. He's like, okay, take this.
And you'll be fine.
And if you feel, and I was like, do I have to come back to you again? He's like, well, if you feel the need to. See, take this, see how you feel. And we'll talk about it. You're a responsible girl, you're a strong girl.
Oh, God.
And I Googled the medicine after I'd seen it, and I was like, and it said some antidepressant, whatever, and I got scared. I was like, oh my god, I'm not depressed.
Yeah. See, sometimes Google is not your friend. No. Sometimes.
Yeah, it's a lot of times. And then, luckily, I had friends who were studying medicine, who told me that stop Googling this, stop trying to figure this out on your own.
Yeah.
And then I said, I might as well talk to my friends about this. Why can't, my friends make me feel better, so why do I have to go out and get help?
Okay.
So the lines of getting help were getting blurry as I was going into this.
And the concept of what help is itself is cute, right? Because what are you talking about? Are you talking about getting help in terms of just popping a pill every day?
Yeah.
And it's interesting, you said you've Googled psychiatrists and psychologists, but then you said I went to counselors. And those are three terms that you've just introduced.
Yeah, actually, can you break them down for our audience?
So basically, this is how it works here. A psychiatrist is a doctor, a medical doctor, is someone who studies MBBS and then studies psychiatry, studies in a hospital, can prescribe drugs.
Yeah.
And their predominant role is to, you go to the psychiatrist, as you said, you talk about what you've gone through, and they'll kind of come up with some sort of a diagnosis, which is, I don't like using the word label or tag, but you kind of club all your symptoms down into one disorder, so to say. And I'm also going to mince my words here, because even the concept of disorder and symptoms and all is undergoing a lot of change.
Sure.
So it's important to realize that these are very flippant terms.
Yeah.
And a disorder, the individual has a disorder, the individual is not the disorder. And even disorder, you could be sad because your dog died, hypothetically, and that doesn't necessarily mean you're depressed,
Right.
So it's important to understand these. But keeping all of these in mind, a psychiatrist is most probably going to identify what disorder you have and give you medications accordingly. But the psychiatrist is not going to sit and talk to you through your issues and try and make sense of what's going on.
Yeah.
A clinical psychologist, on the other hand, does, I don't know, have you ever done tests when you've gone to a clinic where they've sat you down and made you do these, pick the word that most suits you, or color the box, or write one sentence, or so and so.
Yeah.
So basically those tests are called psychological evaluations, psychological tests, and you have various kinds of tests. I mean, you're basically working in the area of disability right now.
Yeah.
So there's a whole separate bunch of tests used just to identify things like autism, which is what you work for. But similarly, you have tests that I help identify if you're at risk for suicide, if you have depression, so on and so forth, even in terms of what your personality is like. And the individual who administers those tests, scores them, makes the report, and can make sense of that data is a clinical psychologist.
Okay.
And a counselor is what you seem to have been looking for all along. A counselor or a psychotherapist is someone you go to and you're with them for the longest time. You have conversation, which is how therapy is understood, but even that we kind of demystify here.
Yeah.
But the counselor is someone you go and meet every week or 10 days and have a session, so to say.
Right.
And they stay with you through the larger part of your journey, which it's where you make sense of what's going on.
Right.
And a counselor is not like you come to me and you say this is my problem, and it's not like a chemistry equation where you give me the left hand side and I kind of tell you what the right hand side is.
Yeah.
It's a space for you that the counselor is as a professional required to create, where you feel comfortable. You don't always have to talk. You don't always have to share what you want to or what you don't.
Yeah.
But the idea is that space is comfortable and safe enough that you feel that there is some sort of change.
Yeah. No, I think that's very helpful. And I wish someone had told me that
early
on.
Yeah.
And I feel like for everybody watching, if you can remember that and know what kind of help you need and get the right kind of help, it's important.
Absolutely, yeah.
So I don't even want to touch upon people, I don't even want to get into the neurodiversity space right now.
Yeah.
Because even for neurotypicals, why is therapy just put in a box as a typical, you sit on a couch, talk to somebody, sort of a thing? And maybe that is not a comfort space for so many people. And because that's not a comfort space, they don't even go out and ask for help.
So, two things that I'd like to add is, one is, even in our conversation, you see there are so many compartments that we're stuffing people in.
Yeah.
And it's really difficult to even come up with a language that is diversity friendly, so to say.
Yeah.
So, and that really bothers me on a very personal and professional level, that we have this concept of a neurotypical and neurodiverse. I think we're all neurodiverse.
Yeah.
Because everybody functions differently.
I know.
But
I
anyway.
wish everybody accepts
or
that.
let's just not have a word. We're all individuals. That's it, right?
Right.
Also, secondly, you spoke about having to sit on a couch and talk, right? I think that's got a little bit to do with how psychotherapy kind of came about. The history of psychotherapy reflects a very someone laying down on the couch, somebody else sitting back and listening to you.
Yeah.
And that's just how psychotherapy started, and and that's called psychoanalysis. And all other kinds of therapy that have built on this concept, they've either turned a little away from psychoanalysis or moved towards it, but everybody's used the medium of language. Recently I was reading about trauma, right? If someone has had a traumatic experience, how do you get them to?
Yeah.
In terms of first stage intervention. And trauma is not stored linguistically. It's stored in your body, and it's stored in images. So talking doesn't work there. But we now fortunately have things like art. They call expressive therapy. So you have dance, play, drama, so on and so forth. And it's not about whether you're an artist. It's not about artistic creativity. It's just about imagination and expression. It's good that we're moving forward, but there also, the flip side is we don't have enough trained professionals who really understand how to use it. It's not a gimmick, I'm not going to give you a piece of paper and say draw and then make you pay me at the end of 45 minutes and say, okay, this is therapy. There's a whole process, it's nuanced.
Yeah.
But again, it's good that we're creating space for something like that. And even if you come to a room and you want to talk, sometimes it takes a lot of sessions for someone who is, so to say, able to articulate to even want to talk. And that's not the job of anybody but the therapist, which is why I keep saying therapy is a space. Because I need to create that space where you feel comfortable enough to share whatever it is that you want to, in whatever way you want to. There's been books written about therapy where the therapist didn't talk at all. If you read books on play therapy, they use sandpits and children have walked through their entire traumatic experience just playing with sand. They've not spoken a word in therapy, and there's been a change. So it's important that we keep that in mind, but also that unfortunately people aren't trained well enough and it becomes a very gimmicky thing. So it's a fine line.
Guys, so this was the first part of our conversation. In the next part, we'll deep dive into these concepts and also talk about issues like stigma and therapy as a space. Please subscribe to our channel and share these videos. You never know who needs to hear this, who needs to educate themselves. If not now, this will be beneficial in the future. The purpose of these videos are to help ourselves learn a happier and healthier way of living. And it's only possible if you keep supporting us the way you do.